All right, let's have a look at Rodrigo. So Rodrigo has a really nice setup here, and he's got a really nice graphic here of the person's X-ray on top of their back, and we can see that they've got a reverse S shape. So there's an apex up in their mid back with the apex on the right hand side, and then there's another apex in their lower back with the apex on the left hand side. All right, we got the setup, so their right knee is down, so that's going to be tilting the pelvis a little bit, and that's going to be taking care or changing the bottom curve from the bottom up, from the pelvis upwards. So it's a really nice setup he's got the person in here. And then what we're doing is he's going to simply ask them to lift their left hand, which is going to help straighten that upper curve. Okay, if they've got the mobility to do that just by lifting a hand, that's going to be fantastic. So he's taking care of the lower curve in the frontal plane and the upper curve in the frontal plane. So fantastic position. Then he's asked the person to breathe in and breathe out. Maybe he's doing what the Stroth calls a directional breath. So he might be breathing into one side of the curve or the other side of the curve, depending on what he's trying to do. But this is fantastic because the way the ribs move when you breathe in, they open up and they actually help the spine move as well. And when the spine moves, it helps the ribs move. So breathing and exercising and holding positions like this is a fantastic way of getting some changes into the body. He also then positions her into a slightly different position with the right hand up. He's getting traction as well, or at least elongation by lifting the arm up, as well as holding the person into the static position. So great exercise, but it is missing, as we had in the last video, he's missing the rotation component as well. So there'll be a thickening in this lady's upper right back, and sometimes her scapula will be a little bit prominent, but it's not so obvious on this picture here. So taking that right hand forward a little bit would be fantastic, and that will just add that little extra dimension to this exercise.